Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
Today, we have two of our most esteemed dermatology colleagues, and they're going to take us all the way back to maybe 35 years ago or so and tell us an amazing journey in dermatology. I'm so excited for this episode. I've actually been waiting a long time for it to happen. I'll do a quick introduction and then I'll stop talking because the story is really what we want to get to. We have Drs. Ilona Frieden and Dr. Vale Reese. Neither one needs an introduction in this community, but as a quick intro, Dr. Ilona Frieden is a pediatric dermatologist and a world-renowned specialist in children's skin disease. She's taught most of us, what we know about pediatric skincare. She has more than 35 years of experience caring for children with skin conditions that can range anywhere from eczema to rare genetic disorders, complex diseases, and she's the former director of pediatric dermatology at UCSF. Dr. Vale Reese also has been on our podcast many times, and he has been in practice for a very long time, about 28 years in private practice now in San Francisco, and he was involved early on. I believe this was more in your medical education. We're going far back with this story. So, Dr. Reese, I'll hand it to you. Would love to get an intro of everything that happened, and you set up how this all occurred.
Yeah, so what we have basically is the origin story for PHACE syndrome. And, obviously having memorized all these different syndromes back when I was a resident in the early 90s, you just assume these things have always been there. And of course, these conditions have always been there. But describing them and delineating them and naming them is a process that actually occurs and we really didn't consider it at the time. So basically, this starts with me. I was a medical student at UCSF, and no big surprise to anybody, became interested in dermatology for reasons that we all understand. And I did just a general rotation, but at the time they had an inpatient rotation also. So I signed up for that, and I was assigned to one of the faculty members, some Ilona Frieden. Now, I assumed, Ilona, that you had been on the faculty for years and years, because what did I know? I was just a fourth-year medical student. But I guess you had started fairly recently, the faculty, is right? You were Kaiser before that?
That's right. So I started in 89 on the faculty. So I had just been there really barely a year when we first met.
Right. So we were a little wet behind the ears, both of us, rotating around. And one of those days, we went to the NICU. We'd been called to the NICU. And there was this newborn patient there. And she had the skin issue was a hemangioma, large facial hemangioma. But it turns out this patient also had some other issues as well, basically neurological issues, in particular, this Dandy-Walker malformation, which is a neurological condition that can affect the posterior fossa. So now most of you watching right now will think, oh, obviously, we're talking PHACE syndrome, but this had not been described yet. So we're staring at this case, and Ilona, I think you were the one to remark pretty quickly that this seemed familiar from a case I think you've seen with Nan, is that right?
Right. So my part of the story is I have this eager medical student with me. And actually we were asked to see a patient with atypical Sturge-Weber syndrome. That was what we were asked to see. And I walked in with Vale, not Dr. Reese at the time, Vale, a medical student. And it wasn't Sturge-Weber. I knew this was a hemangioma. I knew it wasn't a portwine birthmark. And in a way, I think I was a little irritated, like, how come they don't understand the difference between a hemangioma and a portwine stain? That's like, this is wrong. But then I realized, oh, there's this posterior fossa defect. And when I had done a really pivotal seminal rotation, I spent 3 months. We didn't have pediatric dermatology fellowships back then, but in 1983, I went to Chicago and worked with Nancy Esterly, who really was the mother of pediatric dermatology, a huge influence on my life. And we had rounded in the hospital on a baby who I remembered really just was in the hospital for month after month with neurologic abnormalities and a big facial hemangioma. And so we saw this patient, and I called Dr. Esterly and I said, did that patient have Dandy-Walker malformation? And she said, yes. And I was like, oh, this probably isn't a coincidence, because, when you see two things, you don't know, like true, unrelated, measles and a broken leg, or is this really a thing?
Yeah. And I will just throw in too that even as a fourth-year medical student, I know that wasn't a port wine stand. I knew that was hemangiomas. So, it gets back to really what we offer as dermatologists, which is we have that visual skill and we recognize it. So basically the next step was Ilona remembered this other case. We had this case. Two things happened at that point. She ended up, I think, reaching out to your other PD derm experts.
Yeah, at some point, we presented this patient at a Society for Pediatric Dermatology meeting. But there's an important point before that, I think, which was to go to the literature. So at that time, we didn't have PubMed, but we did have this thing called Medline. It was pretty new, and you could put in a diagnosis, and you could put in hemangioma and Dandy-Walker malformation, which is what, I told Vale and what he ended up doing. And what happened? Zero.
So again, for the kids, this is shocking. So we actually had hard copy books called journals in these dusty stacks over the UCS Left Library. So I go down in like the basement of the stacks and you roll these things and these big shelves are going back and forth.
Very dusty work.
Yeah. And basically I was looking at the neurosurgical literature and actually hemangioma, but we also cross-referenced for port wine stain, for Sturge-Weber. And it was so interesting. I would pull up these articles, there'd be an image and they're calling it Sturge-Weber, but no, even in the image, you could tell it was a hemangioma.
Yeah.
And that's where we were able to actually cull a fair number of these historical cases that had never been tied together because, again, they didn't have that dermatologic perspective.
What I think was key to this was, and this is, I think, key to describing new things, is that you came up with, you put in Dandy-Walker or you look for hemangioma and then looked for association with Dandy-Walker, there was nothing. But if you went to case series of Dandy-Walker, and I remember in particular, the Toronto Sick Children's Hospital had the largest case series of Dandy-Walker. Like a third of the patients had a facial hemangioma. And we were like, whoa, this is real. So then we knew by looking, which is really the sort of secondary level of looking at references and trying to find another way in. And so then I went to the pediatric derm meeting and I presented our case and I said, has anyone else seen this? And there were about 9 hands that went up in the audience of people who had seen this. So that was like when we knew, aha, this is a real thing. We did, and a true association, not a coincidence.
Now, the next thing that happened, it's very important in the story, was that we decided to write this up. And Ilona Frieden actually let me be the first author on the paper. So that just shows what an incredible human being she is. She didn't have to do that. And perhaps later she regretted it. I don't know. But it was too late. I was the first author. And that went to press. Now, any of you listening will think, well, wait a minute. Is it just hemangioma and this neurologic? Aren't there other components to this syndrome? Well, that's where we get to chapter 2.
Yeah. So chapter 1, we published in Journal of Pediatrics, which was a very prestigious, high-impact journal in pediatrics, the association of facial hemangiomas, Dandy-Walker, and other posterior fossa malformations. So that had nothing to do, that really is not, in fact, the most common manifestation of FACE syndrome, which is arterial anomalies. So fast forward, and that was a big deal. And Vale, meanwhile, matched it Brown. He became a dermatology resident, and which was really great. And then I'm still seeing patients at UCSF as an academic pediatric dermatologist, and I get referred another patient. And this patient was referred to me with a facial hemangioma. She had had a stroke in utero, but she did not have a posterior fossa malformation. So I'm like, what? This doesn't quite fit. But what she did have was along with her stroke, was very abnormal intracranial circulation. So I'm telling Vale about this. We're still in communication. And then I see another patient referred to me who has posterior fossa malformation, hemangioma, was referred by another one of our former graduates, Ron Scheel, I think it was. And that patient did have posterior fossa abnormalities, but also had circulatory abnormalities of central nervous system. So one thing we did was we went back to our original article, and it's amazing how you can write something and then read it and learn from it. And sure enough, many of the patients who we had reported had intracranial abnormalities of their arterial circulation. But we hadn't focused on that because when you have a Dandy Walker malformation, you go see neurosurgery, you get a shunt. It's a very big deal, and it can be diagnosed in utero. Whereas at that time, we were not doing MRIs and MRAs on patients on a routine basis. So to diagnose arterial abnormalities, you had to have something a lot. It wasn't just something that was you just do an MRI and you'll pick this up. It was really a big deal. And in fact, someone who had described this previously and hadn't called it PHACE, of course, was a pediatric neurologist in Spain called Pascual Castroviejo. And in Spain, what we came to know as PHACE syndrome was in fact called Pascual Castroviejo syndrome number 2, because this gentleman he liked things named after himself, obviously. He already had a Pascual Castroviejo syndrome number 1, which was kind of amazing. All of which we were completely transparent about when we decided, well, we really need to write up these cases because we missed a big important part of this in terms of the title of our article and what we wrote. So then I circled back to Vale because I said, Vale, this is important. And why don't you tell your part of the story next?
So at this point, I'm a second or third year resident at Brown. And of course, we're all very focused on memorizing and preparing for the derm boards and all of that. So Ilona starts to list these different things, and I'm in total mnemonic mode of creating these little tricks to memorize these things. So I'm putting this around, and I'm wait, P, H. I put it all together. Oh my God, we could call this PHACE syndrome, PHACE. Look, you got the posterior fossa, you got the hemangioma, arteriovenous, you got a little, what's left over? Cardiac and eye, face. So I reach out to Ilona and I say, I've got it. Lightning in a bottle. I figured out because there's so many acronyms, guys, let's be frank, where they put together an acronym and it really has nothing to do with the actual conditions. But PHACE actually, it actually ties in. So I'm pretty proud of this, actually. So I go back to Ilona and I said, hey, I've got this great acronym. And Ilona says,
I don't like acronyms. And I really don't like acronyms. And Vale says, no, they're really important. I'm studying for the boards. And I said, you know what? Okay, you're probably right. Even if I personally don't love acronyms, I think you're probably right.
Because it could have been Ilona Frieden and syndrome 2.
Well, and the thing is, I didn't want it was named after me. So that was the other thing. I really did not want it called Frieden syndrome because I kind of don't like that on a couple levels. And, things have gotten renamed that were named after people, but then they did bad things. And so they, canceled them out and stuff. I just feel like for me, it was, this is for some patients, although it turns out not for most, kind of a sad thing. And I don't really know that I want something named after me that causes a lot of heartache and medical issues for patients either. That was maybe a little selfish on my part, but.
My response is I say to Ilona, well, just name it after me. Now, I'm much better being famous for my dermatology and movies thing, which came later. And the next clever thing I came up with was calling that skin and cinema or skinema. So that's my 2 contributions. But no, and think of how cocky I was. Here I was, a second-year resident, standing up to this giant of dermatology, Ilona Frieden, saying, now what's ironic, actually, is here I said, we should call it PHACE because it's really going to help people in dermatology basically recognize the syndrome, but also be able to memorize it and be able to, see it on a test. I would wager that PHACE syndrome probably doesn't show up much on boards because it's too easy, right? Because of this acronym, if they're going to see, what does this patient have? Hemangioma, obviously it's going to be answer C, face. So they probably don't put it on very much, but I'll tell you, that's actually the point too. If it's actually easy to remember this, that was the whole point of the acronym. So success, as far as I'm concerned.
And acronyms, you think about it, acronyms have become so much more common. Like you see, every drug study has an acronym. I mean, acronyms are, it is a little English language centric to use that acronym, because PH is not in many languages, something that people recognize as being pronounced F, for example. But nonetheless, I think it certainly has stood the test of time, and I'm actually glad that Vale talked me into it. This report, which we published in Archives of Dermatology in 1996, I did put myself as first author because they were patients that I had seen, but Vale is a co-author on that paper, along with a pediatric endocrinologist who had seen a patient. And so that was 3 cases. But really, the way I think about that article, because Pascual Castrillo-Viejo, as we acknowledged, had reported a number of patients where he had to do cerebral angiograms, because that was the standard back in the 1960s and 70s, and documented these findings. But we really connected the dots, is the way we describe it, because we realized that some patients just had the hemangioma and the arterial anomaly. Some patients had posterior fossa and hemangioma. Some had coarctation of the aorta, and a few had all of these things, including sternal, which we didn't put an S on the end, but we considered the sternal clefting as part of PHACE syndrome even then. And I still call it PHACE syndrome. Some people call it PHACES because of the S for sternal clefting. But in any case, people know it's a common and once you have something, then all of a sudden, in retrospect, it seems like, well, it's very obvious. But at the time, it wasn't.
Yeah, which I think is part of the point of today's podcast, really, is that there are things that are out there. Lyme disease, when I was in medical school, they didn't realize it was related to infection. They thought it was this inflammatory response to something. And it may be that, there's other things. I personally think that seborrheic keratoses probably are triggered by viruses, but that's my own conspiracy theory. But my point, I guess, is if you see something odd, let's not assume that it's just a one-off. There may be something more there. Now, okay, it was ancient history. That original patient we saw was 35 years ago.
Yeah.
But there's still room, I think, for exploring, new syndromes and things even today.
Yeah. And then part 3 of the story is really just what happened after that, which is that PHACE syndrome, we have some evidence that it is as common as Sturge-Weber syndrome. It's not as classic as a neurocutaneous disorder, but it certainly is very well recognized. There's been 500 articles if you do a PubMed search where you search for PHACE syndrome starting in 1996. So there's about 20 to 50 articles a year that get published about this. It's in all kinds of specialty journals. We occasionally see adults who didn't have large facial hemangiomas recognized even maybe. And so there's a very wide spectrum. Frustratingly, we have not found a cause. And when we get to the future, I can talk about kind of what I'm hopeful for. But whereas most birthmarks in dermatology have been found to be due often to somatic mutations in oncogenes, that has not been true at all with hemangiomas or with PHACE syndrome. So the people have looked very hard. We still don't know a cause, if there is one cause. But there.
I will just interject. I really think you've dropped the ball on that, Ilona. So
yeah, right.
Hopefully you can step up your game a little bit in this whole dermatology thing, right?
Exactly. No, but Don Siegel, who's at Stanford now, has looked and done really comprehensive genetic studies looking at parents and their children to see if there are subtle genetic differences, looked at tissue, all those kinds of things. And it's just turned out to be and that's been true for hemangiomas in general, it just hasn't been elucidated with the standard genomic approaches, which we now use using next generation sequencing. But there's a family support network called the PHACE Syndrome Community, a wonderful group we recently published a study looking at patients over the age of 10 because we didn't have enough information on, well, what happens to these young patients. We've known for a long time that, and we still don't have an explanation for this, that it's predominantly a disease of girls, of females.
Also true of hemangiomas in general.
Yeah, but even more true of FACE, and we don't know why that is. There are speculations, but just that. So there's lots of unanswered questions. The FACE over 10 study, I'm very proud of. It was a multi-center study that got published in the Journal of Pediatrics again in 2024, and found that the majority of patients who have FACE, when they get older, they have headaches. Some of them do have learning challenges. And they really have a spectrum of conditions from very minor health issues to sometimes very impactful ones. So that was a very important study to do because it's hard to sort of track down these patients once their hemangioma is better, unless they have severe neurologic problems. We sometimes don't really know what happened to them. So that was, I'm very proud of that. Mitchell Braun was, again, a UCSF med student. He was the first author on that study.
I'll tell you, when I learned, it was after the fact, about this support group, which I know, Ilona, you're extremely involved with. I tell you, I think I teared up a little bit. The concept that this one patient we saw 35 years ago, putting together this syndrome and the acronym would be now so established that, and why wouldn't there be a need for a support group like that? I just found that quite amazing. So kudos to you, Ilona, for really following through, because you could have moved on from this whole syndrome too, but you've stuck with it. So,
well, I am on the medical advisory board, but many other people like Denise Metry, who came as a rotating dermatology resident to work with us and just worked so hard after Olay to start that, help as medical advisors to start that group even more than me. It's been a successful patient advocacy organization, and so such a needed and wonderful contribution.
Ilona, I have a question for you. So, so this is my really one time that I've ever, helped to describe and name a syndrome. But I imagine you've had a lot more of those that you've done?
Trying to think. Well, yeah, I mean, I have been involved in sort of, I don't know if I actually have named any other syndromes. I have to think about that. I've certainly been involved in descriptively helping to describe and elucidate a lot of other dermatologic conditions, not necessarily all genetic, but
so it sounds as though we really academically we're kind of on the same level then as far as accomplishments.
Well, for sure. Yeah, I might have a few more published articles than you, but
yeah.
But I think this will be probably, if on the epitaph or my gravestone, that this is probably one of the things I would be most famous for, even now, and it really did start with one patient and with a disconnect with that patient. Like, what? They're calling this Sturge-Weber. I feel like a lot of my research is kind of spurred a little bit by, not irritation, but just like, wait a sec, that's not right. That's not, or having learned something and then have to unlearn.
It's the scientific method, right? Someone's got a petri dish with some fungus growing in it. They could have thrown it out. They look down, they realize, wait, that's penicillin.
Yeah, exactly.
You want to remind the listeners too, just because something doesn't seem right or goes wrong a little bit, that's actually maybe a window into a much bigger picture. So.
What a great story. I'm so lucky to hear this from both of you. I loved it. And this is the best part of dermatology. I think over time, we've talked on this podcast too about how there's so much like a move on social media and different things, a little bit of people not really knowing what dermatology is or what dermatologists do. And I think this story just exemplifies to perfection the importance of the dermatologist in the medical community, because there are so many conditions that have come out and described from us because we're very descriptive, we're very visual, and we spend some time putting things together. So this has been just so great. But as part of the story, I have to see like the ending. What's chapter 4? And we always, actually, it's very fitting because on the podcast, we always ask what are you excited about for the future of dermatology? But yeah, I'd love to hear what do you think is next for patients with PHACEs or any other of the neurocutaneous conditions, because I'm sure you see so many interesting things in pediatrics. Where do you think it's going?
Dale, do you want me to start or you want to start?
Well, I was just going to say, once the geneticists figure out the etiology, then we can have this podcast again, and we'll add their face, PHACE, to one of these little boxes here. I think that's what I would say.
Yeah, I mean, I think it's going to be so interesting, and I hope I'm around for the actual denouement, for the end of the story, in the sense of the etiology. It's been, as I said, frustrating, but I take hope from all of these other syndromes that we see. So what we used to call Klippel-Trenaunay A, we know is mostly due to PIK3CA, a very well-known oncogene, mutations, activating mutations, causing dysregulation of growth and development. And we have repurposed medications, sirolimus, alpelisib, borrowing a lot from the oncologists because these are oncogenes to treat our patients, often at different doses or for different indications with different need for different outcome measures. That's a huge part of what's going on in dermatology right now, and particularly pediatric dermatology. You have patients with Netherton syndrome, which is a congenital ichthyosis, but those patients have a huge amount of inflammation, and some of them are really helped by drugs that might be used to treat psoriasis because the dysregulation causes a kind of inflammation that makes them very miserable. So I think that the idea of understanding the genomics is important, but it's not just DNA. And I think we pretty much know it can't just be DNA. And so now you have to go to where are things going with RNA and RNA transcriptomics and things like that, that there must be something that's going on functionally in a vulnerable population of patients. And then the other thing that we haven't quite figured out, but that was a big part of the journey for me, was just the regional aspects of disease and how, why were these occurring in a certain pattern on the face? So we ended up mapping out hemangiomas on the face and actually discovering that one of the areas that was involved wasn't even in the embryology textbook. So that was a bizarre little side journey for me, and working with embryologists to try and understand that. So I know that there's so much more that can be done. And what I'm excited about is the idea of translating that directly into patient care, which I think already is happening with some birthmarks, where we're using, if something turns out to be a vascular tumor due to BRAF V600E, that's a gene all dermatologists know about because it's the most common cause of nevi. But if you have it in your blood vessels, it can cause tufted angioma. And you can use BRAF inhibitors to try to treat that, just as you might a melanoma. So there's a whole spectrum of options open to us in the future to look at these scientific advances. And I think there will be more and more of that over time. That excites me.
No, absolutely. And that's a theme that we've talked about with other disorders too, just how like at the advent of the genomics, proteomics, and then the AI going into the mix and helping to figure out, on a scientific molecular level, at these historical, large disorders. So it's a really fun time to be a dermatologist, actually. It's really great. But thank you both so much. This has been so great. And thank you for all the time that you give to us, all the education. And I can't wait for everyone to hear this. It's fascinating. But thank you both.
I'll give a final credit again to Ilona Frieden. I mean, I wish all academics in general were as giving, as involving as you, Ilona. I think so many of us have benefited from your mentorship, and hopefully we've paid some back, whether we're throwing in little acronyms or other things. So all you other academics out there, let some of the other people get their first name on the paper and involve them, because I think the specialty grows because of that.
Yeah. Well, thank you for that. And I just have to feel that I feel just like such a lucky person to have found dermatology, as we all do, I think, to have found it, to have found something that I was really good at, but where I could also help people and teach. And I know that the future generations, I hope will lead by example, just as Dr. Esterly did for me and as I try to do for other people.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.